CNA Fall Prevention Strategies. Welcome to the quiz. Question 1. A 92-year-old female resident with advanced Alzheimer's disease is sitting in the common area, rocking back and forth in her chair and moaning softly with a grimacing expression. She ate about 50% of her meals today. Her care plan notes a history of constipation and osteoarthritis. What is the most comprehensive initial assessment for you to perform? Option A. Approach her calmly, crouch to her eye level, and speak gently. First, check her brief for incontinence. Next, gently palpate her lower abdomen for distension, indicating a full bladder. Then, ask a simple question like, "Are you hurting somewhere?" while observing her reaction. Note your findings to report in detail to the nurse. Option B. The rocking and moaning are likely self-stimulating behaviors common in late-stage dementia. Sit quietly beside her and gently rock with her to create a connection, then document the behavior in the chart. Option C. Since she is moaning, she is likely in pain from her arthritis. Go to the medication room and administer the PRN acetaminophen ordered for her to provide immediate relief. Option D. Immediately take her to the bathroom, as rocking and moaning are classic signs of needing to void in nonverbal dementia patients. Place her on the toilet and use the call light to request assistance to stay with her. The answer is A. A systematic assessment helps identify the cause of distress before intervening. Option A is correct because it provides a systematic assessment to identify possible causes, pain, bladder distension, incontinence, before intervening. Option B is incorrect because dismissing the behavior as self-stimulatory may miss underlying issues like pain or discomfort. Option C is incorrect because medicating without assessment could mask symptoms or be unnecessary. Option D is incorrect because assuming a need to toilet may be incorrect and could cause distress if she doesn't need to go. Question 2. A 67-year-old male resident, postoperative day 1 from total right knee replacement, is on fall precautions and anticoagulants. You enter his room to find him attempting to get out of bed alone to go to the bathroom, stating he didn't want to bother anyone. What is your priority action and subsequent plan? Option A. Tell him to wait right there while you run to get a second person to help you, leaving him sitting on the edge of the bed alone while you find another CNA. Option B. Quickly rush to his side and firmly push his legs back onto the bed, scolding him for attempting to get up alone after surgery. Remind him of fall precautions, reposition him, and hand him the urinal. Option C. Calmly but quickly move to his side and place yourself in front of him to prevent him from standing. Thank him for telling you he needs help. Assess his pain level and ask if he feels dizzy. Explain you will help him safely get to the bathroom with his walker and non-slip footwear, and possibly get a second person to manage tubing and support his surgical leg. Option D. Assist him to stand up since he is already halfway there. Tell him to put all his weight on you and his good leg, and quickly walk him to the bathroom to meet his need efficiently and prevent him from trying again alone. The answer is C. Ensuring safety while addressing the resident's need is the priority. Option A is incorrect because leaving him alone on the edge of the bed is unsafe. He could fall while you are gone. Option B is incorrect because scolding and forcing him to use a urinal may not address his urgency and could cause distress. Option C is correct because it ensures safety by preventing an unassisted fall, assesses his condition, and plans a safe transfer. Option D is incorrect because assisting him to stand without proper support and assessment risks a fall or injury to his surgical leg. Question 3. A 55-year-old female resident with multiple sclerosis is experiencing a flare-up, leaving her with significant weakness and spasticity. You are assisting her with a transfer from wheelchair to bed using a gait belt. She tells you, "I'm just so tired today. I don't think I can do this. Let's just forget it." What is the best way to proceed? Option A. Offer to put her to bed in 1 hour, hoping she will have more energy. In the meantime, reposition her in her wheelchair and leave her in the common area to watch television. Option B. Gently encourage her, saying, "I know you're tired, but you'll be so much more comfortable in bed," and it's important for your skin to have a change of position. I'm here to help you, and we can do this very slowly together. Let's just try to stand for a moment and see how you feel. If it's too much, we can stop. Option C. Respect her wishes completely. She has the right to refuse care. Document her refusal to transfer and make a note that she remained in her wheelchair. Option D. Tell her that it's not safe for her to stay in the wheelchair all day and that she has to get into bed. You will need to be firm and use a two-person transfer with a mechanical lift if necessary for her own good. The answer is B. Balancing encouragement with respect for autonomy is key. Option A is incorrect because delaying may not resolve her fatigue, and she might remain in the chair longer than safe. Option B is correct because it respects the resident's autonomy while gently encouraging necessary care. Option C is incorrect because simply accepting refusal may miss an opportunity to provide care that benefits her skin and comfort. Option D is incorrect because forcing care disregards her autonomy and can cause distress. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. You are assigned to provide a bed bath for an 80-year-old male resident who is Jewish and adheres to Orthodox traditions. He is alert and oriented. A male CNA colleague is available on the unit. What is the most culturally sensitive approach? Option A. Proceed with the bath, but ask a family member to be present in the room to ensure the resident feels more comfortable, allowing you to complete your assignment. Option B. Since you are already assigned, proceed with the bath. Maintain his modesty by keeping him covered with a bath blanket and only exposing the area you are washing, as this is the standard of care for all residents. Option C. Before you begin, knock on his door and explain that you are there to assist with his bath. Ask him, would you prefer that I assist you with your bath this morning, or would you be more comfortable if I asked my male colleague to assist you instead? This offers him a choice and respects potential religious preferences. Option D. Immediately go and ask the male CNA to swap assignments with you without consulting the resident, assuming he would prefer a male caregiver based on his religion. Then inform the resident of the change. The answer is C. Asking about preference respects the resident's autonomy and cultural needs. Option A is incorrect because involving a family member without his consent may violate his privacy and does not address his preference directly. Option B is incorrect because it assumes standard care is sufficient, but some Orthodox Jewish men may prefer not to be touched by a woman. Option C is correct because it directly asks the resident about his preference, respecting his autonomy and potential religious or cultural needs regarding modesty. Option D is incorrect because assuming his preference without asking is presumptuous and disrespects his right to choose. Question 5. A 70-year-old female resident with type 2 diabetes and peripheral neuropathy was found on the floor beside her bed at 2 a.m. She is alert and states she fell trying to go to the bathroom. She denies hitting her head but reports sharp pain in her left hip when she tries to move her leg. What is the correct sequence of actions? Option A. Do not attempt to move her. Keep her calm and comfortable by covering her with a blanket to prevent shock. Immediately activate the emergency call system to get the nurse to the room stat. Stay with her, reassuring her, and report exactly what she told you and what you observed to the nurse upon arrival. Option B. Try to determine the extent of the injury by gently asking her to lift her left leg. If she can do it with some pain, the injury is probably minor. If she cannot lift it, then go get the nurse. Option C. Go and get a second person so you can perform a two-person lift to carefully move her back to bed, then report the fall and her complaint of pain to the nurse after she is safely in bed. Option D. Since she is alert and moving her extremities, she is likely okay. Carefully help her stand up and walk back to bed. Then put the bed alarm on and document that she was found on the floor and return to bed without injury. The answer is A. Immobilizing a resident with a possible fracture prevents further injury. Option A is correct because moving a resident with a possible hip fracture can cause further injury. Option B is incorrect because asking her to lift her leg could cause pain and is not an appropriate assessment. The nurse should evaluate. Option C is incorrect because moving her without assessment risks injury. Option D is incorrect because helping her stand could worsen a fracture. Question 6. You are feeding a 90-year-old resident with dysphagia who is on a nectar-thick liquid and minced meat diet. She suddenly begins to cough forcefully, her face turns red, and she has wet-sounding respirations. What is your immediate action? Option A. Encourage her to take a sip of water to help wash down the food that is causing her to cough. Option B. Stop feeding immediately, instruct her to lean forward slightly, and encourage her to keep coughing to try to clear her airway. Stay with her and observe closely. If the coughing does not resolve the episode or she becomes unable to cough or breathe, activate the emergency response. Option C. Slap her firmly on the back several times to dislodge the potential obstruction, as this is the first step in managing a choking episode. Option D. Leave her to go get the suction machine set up at the bedside so you can suction her airway if needed. The answer is B. Encouraging natural clearing of the airway is the first step for a conscious, coughing resident. Option A is incorrect because giving water could cause aspiration. Option B is correct because the resident is coughing and has wet sounds, indicating she is trying to clear her airway. Option C is incorrect because back slaps are for complete obstruction, inability to cough or speak, not for a coughing episode. Option D is incorrect because leaving her alone is unsafe. You must stay and monitor. Great job! Don't forget to subscribe. Bye.